Hey everyone, this is your podcast host, Casey Callanan, for today's special episode of the Dr. Todd Show, sponsored by Boston Scientific. We encourage you to visit edcure.org to learn more. Hey everyone, welcome back to the Dr. Todd Show. I'm your host, Casey Callanan, for today's episode. I'm really honored to be here. Today we're talking about an intro to penile implants. Of course, this man standing here to my right, sitting in here to my right, is Dr. Todd. Dr. Todd, why don't you just welcome us to the show by telling us your name and how long you've been doing this.
Well, thank you, Casey. Welcome to the Dr. Todd Show. I am a board-certified urologist in Northern Virginia. I've been doing penile implants since my residency in 2002 to 2008, and I'm one of the highest volume penile implant surgeons in the world.
And, first and foremost, I want to get risks and benefits of the penile implant for our audience, for our listeners, for our watchers. Tell us about its benefits, first of all.
Well, penis is a vascular organ that has to fill with blood. If for one reason or another, due to aging, medical conditions, surgeries, neurological conditions, you cannot fill the penis with blood to become rigid, something has to be done to be able to inflate it. Therefore, the penile prosthesis is an excellent solution. It's a completely concealed device that's placed surgically by an expert to allow you to get a very full erection, very natural looking erection, to be able to have penetratable intercourse with your wife as much as you need, as long as you need, without losing sensation or urinary issues or other problems.
Yeah, and let's talk about some of the risks.
Penile prosthesis is just like any other surgery. You're inserting a foreign body into the body. If the surgery is performed in a very sterile technique and by an expert with high volume numbers, the risk of infection is less than 0.5% to 2%. The risk of infection is higher in diabetics, men with spinal cord injuries or open sores in their body.
Now, what would you tell to a man who comes into your office and is just kind of weighing back and forth on the decision? They might not be sure that they think this is right for them. How do you help that man navigate that decision?
Well, I see patients every day in my practice. They come to me and they say, "Doc, I haven't responded to oral medications like Viagra, Cialis. I haven't had sex with my wife in 6 months, eight weeks, or many years." And what they want to know is there something there for them? And I always do a penile duplex ultrasound to evaluate their vascular function, whether they have artery problem, vein problem. And if they fail and they're not happy with their quality of life, I ask them a simple question. Do you want to have sex with your wife or not? If yes, then penile prosthesis is the most likely best and most successful solution for you.
Yeah, that makes a lot of sense. And, any other sensitivities when talking with the partner? I know that it's kind of a lot of times you have these discussions with the man and the partner as well. Talk to me about how you navigate the conversation with the partner.
The partners are obviously, they don't know what it is going to look like and how it's going to feel. But the literature shows that they have a 96% satisfaction with the partner. Okay. I have never heard a wife or a partner of one of my patients say that they're absolutely not in love with their husbands. Yeah. I see patients coming in before the penile prosthesis with their shoulders down, with a depressed look of a defeated army type of soldier. And then you see them 6 months later, they look like they are like athletes from the Olympics and they got the gold medal.
I love to hear that. Dr. Todd, how would you navigate a decision-making process with a man who is intimidated by the penile process?
I basically tell them, listen, if you have a broken or an arthritis of the knee, do you want to walk with a cane for the rest of your life, or you want to fix the knee and be able to run? And this is the same concept. Penis is just like any other organ. If it's not working and the blood is not coming in, do you want to wait until you die, or you want to fix it so you enjoy the decades of your life that's left and be able to make love to your wife or partner just like when you're in your 20s? And that's kind of a where the dilemma is. I think that you have to develop trust with your patients to say, listen, I do this all the time. This is not something I do 5 times a year. I do this 5 times a week. And I look at your penis. I think that you will have a good size implant and you will love it. And you just look him in the eye and say, listen, this is the option available. Yeah. And the beauty of it, Casey, is that Medicare covers the implants. So,
yeah, I was going to ask about insurance. Tell us about that. Does insurance cover this?
Well, I mean, Medicare covers currently the implant. Some of the Blue Cross, Blue Shield, and some other commercial insurance cover it. You can always see us and be evaluated, and we can send a formal request for authorization from the insurance company, or there's a self-pay option as well.
Yeah. And these are really important notes to cover. And is there anything else that might be of value when you talk about the penile implant and an introduction to it that you wanted to make mention of before we wrap it up?
I think in general, we have to educate patients. They have to read about it. I always like to show them what the device looks like. Yeah. That it's a hydraulic system filled with saline, which is salt water, and it's completely concealed. The incision is less than 1 inch. And, it's the healing process. And I always like to show them images of inflated implants in real patients, like 6 months out, and to say, is this a patient with an implant? I'm like, exactly. This is a patient with an implant.
Dr. Todd, it's been a pleasure to be here once again today. I want to shake your hand. And
thank you so much, Casey.
Tell you thank you for having us. And
absolutely.
This has been the latest episode of the Dr. Todd Show, and it's been a pleasure to host you.
Thank you.
All right.
Bye-bye.
Hey everyone, thanks again for listening to today's episode of the Dr. Todd Show. Today's episode was sponsored by Boston Scientific, and we invite you to learn more by visiting edcure.org. You can also check out their latest video series there by visiting edcure.org/hard. Thanks again to Boston Scientific Urology for sponsoring today's episode.